big gas also, solid liquid gas also. Blood flow, they traveling from one point to another. Embolism, transported material, intravascular mass, transported mass, embolus, remove to one point to another, detaching, in detach. One thrombus is thromboembulance, thromboembolism, solute example, एम्बुलेंस सॉलिड ही होते हैं.
From your image, the topic is embolism. Definition. Embolism is the obstruction of a blood vessel by an embolus, a detached intravascular solid, liquid, or gaseous mass that is carried by the bloodstream from its site of origin to a distant site. Remember, embolus equals detached mass, travels, blocks vessel. Types of emboli, open quote. Embolism is the obstruction of a blood vessel by an embolus, a detached intravascular solid, liquid, or gaseous mass that is carried by the bloodstream from its site of origin to a distant site. Close quote. 1. Embolism, meaning blockage of a blood vessel. Think of a water pipe. If something gets stuck inside, water cannot flow. Similarly, in embolism, blood flow is blocked. 2. Obstruction. Obstruction means blockage. So, obstruction of a blood vessel means the blood vessel is blocked and blood cannot flow normally. 3. Blood vessel. Blood vessels are tubes that carry blood. They include arteries, carry blood away from the heart. Veins carry blood back to the heart. 4. Embolus. An embolus is anything that travels in the blood and blocks a vessel. It is the object causing the blockage. 5. Detached. Detached means broken off or separated. Example, a blood clot forms in the leg and then breaks off. After breaking off, it becomes an embolus. 6. Intravascular. Intra all's inside. Vascular is blood vessel, so intravascular means inside a blood vessel. 7. Solid, liquid, or gaseous mass. An embolus can be solid blood clot, most common, tumour cells, liquid, fat droplets, amniotic fluid, gas, air bubbles. 8. Carried by the bloodstream. The embolus travels with the flowing blood, just like a leaf floating in a river. 9. Site of origin. This is the place where the embolus first forms. Example, a clot forms in the veins of the leg. 10. Distant site. This is the place where the embolus finally gets stuck. Example, the clot travels from the leg to the lungs and blocks a pulmonary artery.
90% एम्बुलेंस थम्बो मतलब 90% एम्बुलेंस सॉलिड ही होते हैं. मोस्ट ऑफ द कॉमन एम्बुलेंस इज सॉलिड एम्बुलेंस. थम्बो एम्बोलिज्म मतलब थ्रोम्बोलिज्म मतलब जब डिटेचमेंट हो जाता है वो थ्रोम्बो एम्बुलेंस हो जाता है ना, वही बोल रहे हैं. लिक्विड एम्बोलिज्म मतलब एमनियोटिक फ्लूइड होता है. लिक्विड एम्बोलिज्म मतलब एमनियोटिक फ्लूइड होता है. और गैसियस एम्बोलिज्म में जो एयर एम्बोलिज्म होता है उस मतलब वो एयर गैसियस एम्बोलिज्म एयर एम्बोलिज्म जैसे कि रियल एग्जांपल इधर बोल रहा है कि मतलब एयर एक्सीडेंट एंटर ए वेन ड्यूरिंग आईवी इंजेक्शन और सर्जरी और एयर बबल ट्रेवल एंड ब्लॉक द ब्लड वेसल. ये बोल type of embolism depend upon the matter of the embolisms एग्जाम्पल 3 होता है. एक सॉलिड लिक्विड गैस होता है. सॉलिड में जिसके ब्लड क्लॉट हो गया, ट्यूमर सेल हो गया, बैक्टीरिया हो गया. लिक्विड में फैट हो गया या एमनियोटिक फ्लूइड हो गया. और गैस में एयर या नाइट्रोजन हो गया. This classify embolism by the material are depend upon the whether infected or not. जैसे कि प्रथम ब्लैंड एम्बोलिजन हो गया, सेप्टिक
Amniotic fluid, gaseous, air, nitrogen. Here we classify the embolus by its material. Depending upon whether infected or not, question, is the embolus infected? There are 2 types. #1, bland embolus, not infected, sterile. Example, a normal blood clot from a leg vein. 2, septic embolus, infected, contains bacteria or other microorganisms. Example, a clot from infective endocarditis that carries bacteria to the brain. Here we classify the embolus by the presence or absence of infection. C, depending upon the source of the emboli. Question, where did the embolus come from? Examples, cardiac embolus comes from the heart. Venous embolus comes from veins, e.g. DVT in the leg. Arterial embolus comes from arteries, e.g. aortic plaque. Here we classify the embolus by its origin, source. D, depending upon the flow of blood. Question, how does the embolus travel in the bloodstream? Blood 1. Orthograde embolus travels in the normal direction of blood flow. Example, a clot from the leg travels to the lungs. 2. Retrograde embolus travels opposite to the normal blood flow rare. 3. Paradoxical embolus. A venous embolus passes through a heart defect, e.g. a patent foramen ovale, and enters the arterial circulation. Here we classify the embolus. Let's understand it step by step with a real example. Definition. A thromboembolus is a blood clot, thrombus, or a part of it that breaks off, travels through the bloodstream, and blocks another blood vessel. Thrombus equals blood clot. Step 1. Formation of a thrombus. Because he is not moving much, a blood clot, thrombus, forms in the deep veins of his leg. At this stage, it is called a thrombus because it is attached to the vein wall. Step 2. The clot breaks off. One day, a piece of the clot detaches from the vein wall. Now it is called a thromboembolus. Step 3. It travels. The thromboembolus is carried by the blood, leg vein, inferior vena cava, right atrium, right ventricle, pulmonary artery. Step 4. It gets stuck. The clot reaches a narrow artery in the lungs and blocks it. This causes pulmonary thromboembolism, pulmonary embolism. Why is it dangerous? Because blood cannot reach part of the lung. The patient may develop sudden shortness of breath, chest pain, fast heartbeat, low oxygen level. Severe cases can cause sudden death. Type of embolism, about 90%. Close quote memory trick. T equals thrombus attached, T breaks off. T becomes thromboembolus. T travels, T traps, blocks a vessel. Definition. Thromboembolism is the blockage of a blood vessel by a detached thrombus, blood clot, or part of a thrombus. It is the most common type of embolism, about 90%. Types of thromboembolism. There are 2 types. Arterial, systemic thromboembolism. 2. Venous thromboembolism. Number 1. Arterial, systemic thromboembolism. What is it? An arterial thromboembolus is a blood clot that enters the arterial circulation and blocks an artery supplying organs such as the brain, kidneys, spleen, intestine, or legs. Where does it come from? A. Causes within the heart, 80 to 85%. Most common. Most arterial emboli come from the left side of the heart because the left side pumps blood to the whole body. Examples, inside the left ventricle. Later, the clot breaks off and travels to the brain, blocking a cerebral artery and causing a stroke. B. Causes with paradoxical embolism. A venous clot crosses from the right side to the left side of the heart through a heart defect and enters the artery. Depend on size of the embolus, site where it gets lodged, collateral circulation, alternate blood supply. 1. Infarction, ischemic necrosis. The tissue dies because it does not receive blood. Examples, lower limb, brain, kidney, spleen, intestine. 2. Myocardial infarction, heart attack. If the embolus blocks a coronary artery, part of the heart muscle dies. 3. Gangrene. If a leg artery is blocked and there is poor collateral circulation, the leg tissue dies and becomes gangrenous. 4. Arteritis and mycotic aneurysm. If the embolus contains bacteria from infective endocarditis, it can infect the artery wall. Sudden death. Sudden death may occur if the embolus blocks a coronary artery, the middle cerebral artery, major artery supplying the brain, meaning venous equals related to veins. Thromboembolism, a blood clot, thrombus, breaks off, travels in the blood and blocks another vein, breaks off and travels through the venous circulation. I. Deep vein thrombosis, DVT, of the lower legs, the most common cause of venous thrombi. Let's break this down. Deep vein. These are large veins location of a blood thrombus inside a blood vessel. Deep vein thrombosis, DVT, a blood clot, forms in the deep veins of the leg. Real life 60 has knee replacement surgery. 1. After surgery, he stays in bed for many days. 2. Because he is not walking, blood flow in his leg becomes slow. 3. A blood clot forms in the deep vein of his calf. This is called deep vein thrombosis, DVT. 4. After a few days, a piece of the clot breaks off. 5. It travels leg vein, inferior vena cava, right atrium, right ventricle, pulmonary artery. 6. It gets stuck in the pulmonary artery of the lungs. This is called pulmonary thromboembolism, pulmonary embolism. Surgery, blood flow slows in deep leg veins. Blood clot forms, DVT, clot breaks off, embolus, travels to lungs, pulmonary embolism. Hagsam definition, lie in the pelvic veins, meaning a blood clot forms in the pelvic veins, veins around the pelvis. Real example, a woman delivers a baby by cesarean section, C-section. She remains in bed for several days. A blood clot forms in a pelvic vein. The clot breaks off and travels to the lungs. Pulmonary embolism occurs. A. Thrombi in the veins of the upper limbs, meaning a blood clot forms in the veins of the arm. Real example, a patient has a central venous catheter, IV line, in the arm or neck for many days. A clot forms around the catheter, it breaks off, it travels to the lungs. Pulmonary embolism occurs. Thrombosis in the cavernous sinus of the brain, meaning the cavernous sinus is a large venous channel at the base of the brain. If a clot forms there, it is called cavernous sinus thrombosis. Real example, a person has a severe facial infection around the nose or upper lip. The infection spreads to the cavernous sinus. A clot forms there. Rarely, parts of the clot may embolize. V. Thrombi in the right side of the heart, meaning a blood clot forms in the right atrium or right ventricle. Example, a patient has severe heart disease. A clot forms in the right atrium. It breaks off. It goes directly into the pulmonary artery. Pulmonary embolism occurs. Most topics in pathology. I'll explain it like a teacher. Definition. Pulmonary thromboembolism is the blockage, occlusion of the pulmonary artery or its branches by a thromboembolus, blood clot. Simple meaning, a blood clot forms in a vein, usually the leg, breaks off, travels through the blood and blocks an artery in the lungs. Flow, DVT, leg vein, clot breaks off, inferior vena cava, right atrium, right ventricle, pulmonary artery, pulmonary thromboembolism. Why is it important? Artery is blocked. Etiology, most important. These include popliteal vein behind the knee, femoral vein, thigh, iliac vein, pelvis. Real example, a patient has hip surgery. Because he remains in bed for several days, a clot forms in the femoral vein. The clot breaks off and travels to the lungs. Pulmonary embolism. Remember for exams, 95% of Step 1, risk factors, venous stasis, slow blood flow, hypercoagulable state, blood clots easily. Examples, bed rest, surgery, cancer, pregnancy. Step 2, a thrombus forms in a vein, usually in the deep veins of the leg. Step 3, the thrombus breaks off. Now it is called a thromboembolus. Step 4, the thromboembolus travels through vein, inferior vena cava, right atrium, right ventricle, cannot reach part of the lung. This is pulmonary thromboembolism. Fat embolism is the obstruction, blockage of small blood vessels, arterioles and capillaries by fat globules. Let's understand each word. 1. Fat droplets usually come from bone marrow or fat tissue. 2. Embolism. An embolism means something travels in the blood and blocks a blood vessel. 3. Arterioles. Arterioles are small arteries that carry blood to the tissues. 4. Capillaries. Capillaries are the smallest blood vessels where oxygen and nutrients are exchanged. 5. Fat globules. These are tiny droplets of fat that enter the bloodstream. When these fat droplets reach very small blood vessels, they get stuck and block them. Real life example, most important. A 25-year-old man meets with a road traffic accident and fractures his femur thigh bone. Step 1, the femur breaks. Step 2, the bone marrow, which contains fat, is damaged. Step 3, tiny fat droplets enter the bloodstream. Step 4, these fat droplets travel through the veins, leg vein, inferior vena cava, right atrium, right ventricle, pulmonary artery. Step 5, the fat droplets become trapped in the small blood vessels, capillaries of the lungs, and sometimes the brain and skin. This is called fat embolism. Into traumatic and non-traumatic. Etiology of fat embolism. 1. Traumatic causes, most common. Traumatic means caused by injury or trauma. These are the common causes. Fracture of long bones, especially femur, tibia, pelvis. Most important, multiple fractures, orthopedic surgery, hip or knee replacement, severe soft tissue injury, crush injuries, burns. Real example, liver liposuction, bone marrow diseases, intravenous infusion of fat-containing solutions, rare. Real example, a patient has acute pancreatitis, fat is broken down abnormally, fat droplets enter the bloodstream, they travel and block small blood vessels. Fat, easy table, femur, acute pancreatitis, pelvic fracture, diabetes mellitus, orthopedic surgery, fatty liver, crush injury, liposuction, burns, bone marrow disorders. Droplets travel through the bloodstream and block blood vessels in organs other than the lungs, especially the brain and kidneys. Let's understand it one by one. Number one, brain, CNS. What happens? Step by step. How pulmonary fat embolism. What is pulmonary fat embolism? Definition. Pulmonary fat embolism is the blockage of the small blood vessels, capillaries of the lungs by fat globules. Line 1, open quote, in patients dying after fractures of bones, presence of numerous fat embole in the capillaries of the lung is a frequent autopsy finding. Close quote. Meaning, people with long bone fractures like the femur often have fat droplets in the lung capillaries. Doctors commonly find these during an autopsy, examination after death. Important, finding fat droplets in the lungs does not always mean the fat embolism caused the person's death. Line 2, open quote, because the small fat globules are not likely to appreciably obstruct the vast pulmonary vascular bed, close quote. Meaning, the lungs have millions of tiny blood vessels, capillaries. Even if a few fat droplets enter the lungs, they block only a small number of capillaries. Most of the lungs' blood vessels remain open, so breathing is usually not seriously affected. Think of it like this. Imagine a city with 1,000 roads, apnea, low oxygen level, hypoxemia, fast heart rate, tachycardia, cyanosis, bluish lips and fingers, severe cases, respiratory failure and death. Real life example. A 22-year-old man has a road traffic accident. He fractures both femurs. Fat from the bone marrow enters the bloodstream. Thousands of fat droplets travel to the lungs. Many lung capillaries become blocked. The patient develops severe breathlessness, low oxygen, blue lips, confusion. This is pulmonary fat embolism syndrome. Easy flow chart. Long bone fracture. This topic is gas embolism, which includes air embolism and decompression sickness. I'll explain it in a simple way. Gas embolism. Definition. Gas embolism is the blockage of blood vessels by gas bubbles, air, nitrogen, or other gases. Simple meaning. Normally, only blood flows inside blood vessels. If air or gas bubbles, two main types of gas embolism. Air embolism, what is it? Air embolism occurs when air enters the bloodstream and forms bubbles that block blood vessels. Causes, intravenous IV injections or infusions. Surgery, chest trauma, injury to large veins, childbirth. Real example. A patient is receiving IV fluids. If air accidentally enters the IV line, the air bubble enters the vein. It travels to the heart and then to the lungs. The air bubble blocks a pulmonary blood vessel. Air embolism symptoms: sudden shortness of breath, chest pain, low blood pressure, severe cases, shock or sudden death. Number 2, decompression sickness, the diver's disease. What is it? This occurs when a diver comes up to the surface too quickly. Why does it happen? When diving deep underwater, the pressure is very high. More nitrogen gas dissolves in the blood and tissues. If the diver rises slowly, nitrogen leaves the body safely through the lungs. If the diver rises too quickly, nitrogen comes out of the blood as bubbles. These bubbles block blood vessels. Decompression sickness. Real example. A scuba diver spends a long time deep underwater. He suddenly swims to the surface. Nitrogen bubbles form in his blood and joints. He develops severe joint pain, the bends, shortness of breath, dizziness, paralysis, severe